Hello and welcome to another video of Tooth Ed. Today we're gonna study about various types of skin lesions and their definitions. First one is macule. Macule are like well circumscribed flat lesions which are discolored. It does not include any change in texture of the skin or thickness. The texture and the thickness is normal, it is flat, lesion is flat. The only thing which is noticeable is that there is a color change due to maybe deposition of some pigment like hemosiderin or etc. Next up we have is papule. An example is in erythema multiforme. So papules are what? Macules kya the? They were flat. Now papules are something that are solid raised lesion. Like there, it will be like a bump on the epithelium. It will like a bump on the epithelium, and on it is raised above the surface. But and also there is a characteristic that they are smaller than 1 centimeter in diameter. So the diameter is less than 1 centimeter. Okay, so this is papule. Papule are solid lesions raised above the surface that are smaller than 1 centimeter in diameter. Example is erythema multiforme. The lesions that are found in this disease are called papules. Now we have is plaques. Plaques are they are larger forms of papule. They are just large papules. Like the definition says, they are solid red lesions that are just more than 1 centimeter in diameter. Like that is, the diameter is more than 1 centimeter. 1 centimeter से ज़्यादा बड़े हैं वो, इसलिए उनको बोलते हैं papules. And they are also solid red lesions that are raised above the surface. And they are also called large papules because papules जो थे वो less than 1 centimeter थे, and plaques are just more than 1 centimeter. Next up we have is nodules. Nodules are nothing but their elevation on the skin which is present deep into the dermis, and the above epidermis can be easily moved over them. Also known as lumps. छोटे-छोटे, I'll just paint the picture over here. So nodules are just elevations on which the above surface epithelium can be moved like this. The surface can be moved above it. Next is vesicles. Vesicles are elevated blisters containing clear fluid that are under 1 centimeter in diameter. Also here we have to keep in mind that the blisters are filled with clear fluid. Also the diameter is less than 1 centimeter. Okay, so the things that has to be kept in mind for vesicles are they are elevated blisters that are containing clear fluid inside them which are less than 1 centimeter in diameter. अब ये जो ब्लिस्टर है इसका डायमीटर अगर 1 सेंटीमीटर से ज़्यादा है, अगर बड़े वाले हैं ब्लिस्टर, तो उसको क्या बोलेंगे? बुल्ले, बुल्ला और बुल्ले. सो द नेक्स्ट इज बुल्ले. बुल्ले आर again just a big elevation filled with clear fluid and the diameter is more than 1 centimeter. यानी ऐसे हम बोल सकते हैं कि बड़े वेसिकल्स को हम बोलते हैं बुल्ले. We can say that because bullae are nothing but elevated blisters containing clear fluid which are just more than 1 centimeter in diameter. That is bigger or larger vesicles. Next we have our erosions. Skin erosions. Erosions are moist red lesions caused by rupture of the vesicle or bullae or due to trauma. Erosion अगर कोई ब्लिस्टर है अपनी स्किन पे, ठीक, जब ब्लिस्टर है, जब ये ब्लिस्टर रप्चर हो जाता है। रप्चर हो गया तो क्या होगा, इसमें से क्लियर फ्लूइड जो था ब्लिस्टर के अंदर वो बाहर निकलेगा, क्लियर फ्लूइड बाहर निकलेगा, एंड जो अंदर का जो है एपिथेलियम दैट विल बी एक्सपोज्ड ना, सो इट विल बी अ मॉइस्ट रेड लीजन विच इज कॉज्ड बाय rupture of vesicles or bulla. Next we have is pustule. Pustules are raised lesions containing purulent material. What is purulent? Purulent is waste products composed of maybe pus or debris, bacteria. For example, you can take is acne pustule. That white material that is filled inside the acne is just the purulent material. Pus, dirt, acne, bacteria and all. So they are pustules. Pustules are raised lesions. They are raised containing purulent material. Right? Next we have is ulcer. Ulcer is a breakage in epithelium or a defect in the surface epithelium. It is a well circumscribed depression. Now this is not an elevation, this is depression. Depression क्यों हुआ? क्योंकि ये जो surface epithelium थी हमारी उसमें breakage आ गया. That breakage, the intactness of the epithelium is lost and there is a breakage or a defect in the surface epithelium. That's why there is a depression. It is a well circumscribed depressed lesion over which the epidermal layer is lost. Okay, layer यहाँ की हट गई है, so there is a depression that we can see. Next is purpura. Purpura is basically seen in the patient of blood disorders, especially the patient those who have very low platelets. So they are reddish purple flat lesions, and they are just flat purplish or pinkish flat lesions which are caused by blood leaking into subcutaneous tissue. सबक्यूटेनियस स्किन के अंदर जो सबक्यूटेनियस टिश्यू है डर्मिस के नीचे, वहाँ पे ब्लड फ्रॉम द वेसल्स कैपिलरीज इज लीकिंग आउट into the subcutaneous tissue. So the surface के ऊपर हमें क्या दिखेगा? It will be purplish reddish lesions that will be seen on the surface due to blood leaking into the subcutaneous tissue. The purpurae are further classified as pateki and ecchymosis. So that's all were the lesions and the definitions. These are being asked in viva. IMP ones are macules, papules, then we have vesicles. Vesicles are also asked, and then we have bullae formation and pustules. Ulcer can also be asked. They are important for viva. Okay, for viva they are important. Now let's revise again. What was that? Macule was a flat lesion. Papule was a raised one but छोटा, like less than 1 centimeter. Papule बड़ा हो गया, more than 1 centimeter तो बनेगा plaque. Plaque is nothing but a larger papule. Then we have is vesicle. Vesicles are blisters that are containing clear fluid and they are less than 1 centimeter. अभी वेसिकल थोड़े बड़े हो गए तो बनते हैं बुल्ले. बुल्ले यानी कि दे आर एलिवेटेड ब्लिस्टर्स कंटेनिंग क्लियर फ्लूइड विच आर मोर देन 1 centimeter in diameter. Pustules are nothing but elevated lesions which are filled with purulent material, and ulcer is a breakage in the epithelium, in the surface epithelium. Thank you. That's all for today, and see you in the next video. Bye.